So we're actually early, so I'm going to try and really talk slowly. No, just kidding. I'm actually known for talking pretty fast and going through my slides really quickly, so they always say like, oh, you only have 30 minutes now. It's like, okay, I can fit it in. But today we're going to be very mindful about trying to do this, since we are talking about mind-body therapies and CF care. Everyone's kind of started off the last day and a half or so with starting how they got into being interested in CF or taking care of patients with CF and families, so I'll give you my little blurb. I went to medical school in Kansas at the University of Kansas and did my training at Children's Mercy Hospital, which is a big children's hospital in Kansas City, Missouri. And at that time, there was no pediatric pulmonologist in all of Kansas City area for pediatrics, and so over 2 million people no peds pulmonary. So CF at my institution was taken care of by infectious disease and GI together. So it was a kind of a combined therapy. So what I thought I would do is I would go off and learn how to take care of CF and become a pediatric pulmonologist. And then I'd come back and I would be the first and only pediatric pulmonologist and grow the program in Kansas City. Well, I went off to Rochester, New York, but I never went back to Kansas City. But in Rochester, I actually was fortunate to work with a physician named Robert Schwartz, who did his NIH training in the early 60s with Paul de Saint-Denis, who many of you already heard of, as being really one of the very initial founders of CF and described the disease along with Dorothy Anderson back in the 40s. So I felt like I really had a strong interest in this. And what Bob Schwartz told me back then is that, much of what you've already heard, is that sometimes it doesn't matter which things you culture out. Sometimes it doesn't matter which therapies that you actually use. Sometimes it really doesn't matter about kind of how you kind of make things work or not work. It had to do more with kind of how you care about patients and how you care about families. And that's kind of like the theme of my talk today. So then after Rochester, I ended up coming out to California in the mid-'80s, and I was a co-director of the CF Center at UC Davis for a couple of years, and then I decided to move to the Central Coast of California and kind of left academic medicine for a number of years. And there, though, I did outreach clinics for UCSF and Stanford. I kind of, one day I put on my Stanford hat, the next day I put on my UCSF hat. And I saw a lot of patients who lived in the Central Coast area for those 15 years. And then in 1999, I had a chance to go down to the University of Arizona and actually do a 2-year fellowship with Andrew Weil, learning about alternative therapies, because if you live on the Central Coast of California, that's what everyone uses. I mean, they would come in to see me after their acupuncture didn't work, after the homeopathic remedies didn't work, after their chiropractic massage therapy wasn't working very well, and they would reluctantly say, like, I guess we could try antibiotics. We could try some of these asthma therapies. But so then I had a chance to go to Arizona and actually learn about them, because we were never really taught much about these in medical school and other conventional areas. So I became there for a couple of years, and then I kind of got back into academic medicine by enjoying the faculty there at University of Arizona, the Tucson Respiratory Center, which is very rich in their tradition of taking care of patients with cystic fibrosis, especially under the leadership of Wayne Morgan. And then I came back to Stanford about 12 years ago, and I've been at Stanford now since that time, and have developed this kind of non-conventional, or kind of the it's not really non-conventional. It's kind of more like what people just don't talk about too much when you go to see your practitioners. Like, you talk about nutrition, but you mostly just talk about calories. But really, what kind of calories? You talk about stress, but really, do you really talk about stress? You talk about different types of therapies that maybe you heard about by your neighbor, your cousin, or your aunt, or your next door neighbor, telling you, like, you should try this, it makes a big difference. Well, how do you know if that's really true or not? So I've kind of gotten into being kind of a resource for a lot of these types of families and these types of patients. This is actually one of my most, the part that I'm interested in most is it actually has to do with mind-body therapies, because I don't have to worry about going to the health food store and finding out whether the supplement really has what it says in it or not, because this is actually in your mind. So I know what's in your mind. I don't have to go through any quality assurance, or I got to any kind of a type of thing to try to ensure that things are really there, because it's all inside of you. So really, it's mind-body therapy. It's really not even considered to be complementary alternative anymore, because it's actually been shown to be studied over the last 50 years to be very, very strong in so many areas. And so this morning, we're just going to review some of these areas. When you think about it, everybody has a different idea about what these therapies might be, but actually it's a large group that encompasses many things that's been studied in some areas in cystic fibrosis. So the objective really is to, what is the difference between complementary alternative medicine and what I call integrated medicine, which is what I practice, and we'll talk about that. Which chemotherapies are commonly used? Which ones are used by cystic fibrosis patients? And what's the role of mind-body therapies in the care of cystic fibrosis? And should mind-body therapies be considered alternative, or actually should they be mainstay? Maybe everyone should be doing this, just like everyone should have Karen in their clinic doing their PT, which I think we should at Stanford for sure after I heard her talk yesterday. So the National Center for Alternative Integrated Health is a new NIH group that actually sponsors these. It used to be called NCAM, National Center for Complementary Alternative Medicine, but they changed it now to Alternative Integrative Health because they wanted to talk about this integrative approach. So complementary health approaches include an array of modalities and products with a history outside of conventional Western medicine. So, like herbal remedies is a good example. Chinese medicine is another example. Ayurvedic medicine, homeopathic, naturopathic. All these things are things that are taught or used outside of conventional Western medicine. Previous studies have shown that individuals who use complementary health approaches to health and well-being or to relieve symptoms associated with chronic disease or side effects is actually very common. I think what really is important is that most people who use these type of health approaches use them complementary to their conventional approaches. So it's not like people are using them instead of. People actually use them in addition to. I keep hitting this flower, sorry. And they had a recent study of over almost 90,000 adults 18 and older was recently published to see just what the incidence is. And this was done by this NCAIH. There's been a little bit of a shift in 2002, 2007, and 2012. But non-vitamin, non-mineral dietary supplements continue to be the most commonly used complementary health approach at each point during over these last 10 years. And that's still because I think that's the easiest thing to do, right? You don't really have to talk about getting good sleep or exercise or nutrition or changing lifestyle. You just go to the health food store, buy another bottle of pills and take those. And it's like, okay, this was easy. So they're still the most commonly used. I think they're actually the one that actually has the most things that probably aren't as effective as all the other modalities. But there are some, herbal remedies and all types of supplements and all types of poultices and all that you can think of that actually do have a role. But we won't talk about those today, thank God. But deep breathing exercises actually were the second most common, almost 11%. This is almost 90,000 people. Yoga, Tai Chi, Qigong have increased since 2002, up to about 10%, and yoga was the most common one used. There's been a small but significant increase in the use of homeopathic treatments. Also acupuncture and naturopathy. The use of chiropractic care and osteopathic manipulation have also increased. And meditation was used by 8% in 2012, keeping it in the top 5. So if you look at these, you can almost tell that they're supposed to be in blue, but a lot of these all have to do with mind-body. I mean, deep breathing exercises, that's mind-body. Tai Chi, yoga, Qigong, meditation, all these are mind-body approaches. So they're actually very commonly used by almost everyone in the United States with or without a chronic illness. How about chronic illness and the use of CAM, this complementary alternative medicine? Well, a Canadian health study of over 400,000 people between 2001 and 2005 showed that about 12.5% of Canadians used some type of practitioner and using these type of modalities. The rate was significantly higher for those with chronic illness, such as asthma and migraines, as 2 examples. And in other studies, they showed that many of these people who use these different types of alternative therapies don't actually disclose them to their primary care doctors or even their specialists. And with people with chronic illness, it gets more complicated, and you have all these things, you have more polypharmacy, you use all these different medications, so it's important to disclose this and ask this because there is a chance of having increased risk of complex drug interactions. We know that CF is now an adult disease as much as a pediatric disease. Advances have increased survival, over 50% or so, or greater than the age of 18. And given the complexity and management of tasks required for a multi-system illness, adequate information about the wide array of topics, that's why you're all here today learning about all these things. So, families want to know, patients want to know. Studies have shown that adults in CF, regardless of disease severity or age of diagnosis, have reported unmet needs for information about their disease. People are really hungry to find out all these different things. This information has included information regarding non-conventional approaches as well. And this was a study that was done of 233 respondents, a median age of 34 years of age, who actually had pretty good lung function, and about 60% were female. And you can see here's just a list of the numbers are in percentages on the right as to what people had questions about. And you can see that new CF therapies, including alternative medicine, was about 30% of people who responded said they wanted to have more information. People wanted to have more information about options for treating CF symptoms, hospice care, how to manage infections, ways to help me gain weight. I mean, it's all over the map. You can see you could actually take this unmet needs and actually make a whole conference out of it just by itself. How about complementary medicine and CF in itself, or integrative medicine? Again, few studies have been documented in using this in children and adults with CF. There was one study, 1992, now that's what, 25 years ago, that 400 patients and families from infancy to 45 years of age were asked about their CAM use, including religious practices, group prayer, physical practices, chiropractic, folk remedies, and other modalities, and that's what was used the most. Other studies have shown that about 60 to 70% of patients reported use some type of alternative medicine, with the most common being group prayer. Again, you have to remember that these are all very regional too, depending on where you're at. If you're in the South, it's different than if you're in the East, it's different than you're in the West or the mountain range. Everybody has a kind of a different approach about what they might use or not use. But these are older studies now, but we know it's very common. The studies have been reported perceived health benefits associated with this alternative medicine, reduced symptoms, greater emotional support, particularly with group prayer, and no patients really reported any adverse reactions. I hope we wouldn't have any adverse reactions to group prayer. But, actually the whole prayer, people who study prayer, it's actually kind of controversial because, who's praying, who you praying to, what are you praying about? So it's a very kind of a spirited discussion when you actually talk about people who do prayer type therapies. In a study of children with CF in 2008, about 73% of patients, mean age 11 years, used at least one type of CAM modality, and most frequently was using prayer, and 77% said that was useful. In an adult study in 2014, about 25% of over 15,000 respondents reported using at least one form of alternative medicine. The most frequently reported was breathing exercises, almost 20%, which makes sense if you have a breathing disorder, why not use a breathing type of exercise? It's very common. I mean, you can just go on the internet and just pick up all kinds of different therapies just about mind-body. You can see there's quantum healing over there by Deepak Chopra. There's Rethink Stress. There's a whole Mind-Body Institute back in the East Coast. Mass General has a huge, the Benson Henry Institute for Mind-Body Medicine. And if you look at that middle one, it actually shows you that if you regulate the immune system, actually stress and mind-body therapies may actually help you fight infections, not get sick as often. Maybe it helps you recover quicker. And our friend Shauna Shapiro over at Santa Clara University has written this book over there on the right about the art and science of mindfulness. It's been shown to be very effective, especially in treating people with psychiatric disorders and psychological problems. So this has also been looked at for all types of therapies as well. So it's very common now, and people have written about it, and they're starting to study it more and more. So what are these mind-body therapies I'm talking about? Well, these are practices like meditation and yoga are among the top 10 complementary therapies, according to that survey I mentioned earlier. So mind-body therapies focus on the interaction between the mind and body with intent to use the mind to influence physical functions and affect the health. Now, we can say like, well, does that make any sense? Well, I can tell you about half an hour before I was giving this talk, I was starting to think I was having some pretty mind-body functions on me. I was starting to think my stomach's a little bit upset. I'm kind of getting a little bit nervous. I'm getting a little bit queasy. And then I just take some nice deep breaths and relax. Think about all the nice people who are going to be out there in the audience, actually listening to attendance all over the country, all over the world. And I'm thinking like, well, that actually relaxed me to the point now where I can stand up here and give you this talk. So there's lots of different therapies that are out there. And so it's a big conglomeration of all types of things. There's the cognitive therapies, and I'll talk about those in a minute. That's kind of more the ones that you do that people traditionally have used for lots of different therapies, even such things as stop smoking and obesity and overeating and anorexia. These are all the kind of the cognitive behavioral therapies. There's meditation, which you've heard about. There's the mindfulness-based stress reduction, which Siri just talked about, and how there's a course that you can actually take to the CFRI. Hypnotherapy, guided imagery, biofeedback, and then one that I actually like that people don't think about being mind-body therapies, but actually how about singing and music and art therapy? And then there's martial arts, including Tai Chi, which people think about being kind of a movement kind of mindfulness, and then things like yoga, which actually has to do with strength, flexibility, but also breathing. So I'm just going to go over a few studies in each of these different areas to give you an idea about what's being done and what's being found. So patients with CF face various psychological issues as a consequence of disease burden and their complex treatment regimen. We all know that's very true. Overall, patients and families have coped fairly well, but there is a subgroup of patients who seem like they have more depression and anxiety. Not common, not for everyone, but there is a subgroup that seems that this is an issue. So what's the current evidence about psychological interventions for individuals in CF and their families? So they reviewed 16 studies with almost 600 participants, and they looked over 1,700 abstracts and titles. And they found a few of the studies were not that strong, but they found a couple that were interesting. One study of massage therapy versus bedtime reading for children and adolescents showed the massage was superior to bedtime reading in reducing parent and children's anxiety up to 30 days on follow-up. So maybe you should read while you're rubbing your child's back. Maybe that's another way to think about it, or listen to some type of nice tape. Although specific intervention studies in patients with CF and comorbid mental disorders are missing, cognitive behavioral therapies should be considered and are likely to improve well-being and adaptations to treatment. This is always an interesting one, and this is maybe a little bit out of the realm of mind-body therapies, but how about cognitive behavioral therapies and diet? It's a struggle, especially in small children and even older children and sometimes even young adults, to really try to keep up your nutrition and really try to take in enough calories. So this is a study of nutritional intervention plus behavior modification on nutrition education. So it was a randomized clinical trial over 9 weeks in a group of 67 CF children, 4 to 12 years of age. And they did it at regular intervals for 2 years post-treatment, monitoring changes in body weight. And then they compared them against 346 children they pulled off the registry. And after 27 weeks, the children in the clinical trial group that received behavioral plus nutritional training demonstrated significantly less decline in their BMI scores compared to children in comparable sample. So this study kind of illustrated that behavioral and nutritional interventions is effective and should be considered into clinical practice to help patients live healthier lives. And I think we all can think about different nutritionists you've met in different clinics over the years, and some actually use this all the time. You may not even know they're using it, but they use it all the time. And some just come in and say like, okay, what are you eating? What are your calories? You should really eat more than this, eat more than that. Okay, thanks, bye. So he really has to kind of do it. How do you actually promote this, and how do you actually bring it to your families and to your patients? This is one of my favorite ones, is hypnosis and imagery. I use this a lot when the things that I do, and I'll mention that in a minute. But hypnosis is a state of human consciousness involving focused attention and reduced peripheral awareness and enhanced capacity to respond to suggestion. So if you can actually get away of all the stuff in your side mirrors and really focus on one thing, you can really become more open to suggestion. It typically involves an induction to the procedure, during which one's told suggestions for imaginative experience will be presented. So usually, you maybe darken the room, you have everybody sit comfortably, maybe you have them sit up nice and straight, and you tend to try to relax to kind of get into this focused state. And this hypnotic state, using one's imagination, may result in a trance-like state. Is everybody in this room, I'm sure, has been in a trance-like state at one time? If you drive to work or drive to school and you don't remember even driving there, you're in a trance. If you watch a movie and you get so ingrained in the movie that you forget you're in a theater, you forget that there's people around you, you forget where you're at because you get so caught up, that's a trance. When I do one of my long runs, people ask me, what did you think about for 50 miles? I said, I don't know. I get in a trance. You get so focused, you kind of just are trying to really kind of think about what you're doing, what your next step is. And a trance could be, your mind is like a sky, the clouds kind of come and go. Sometimes you have a very blue sky. There's no thoughts, you're just there. Sometimes you have a really cloudy sky. There's lots of things that are kind of coming in and out. These are all different ways to try to get your mind at ease. So one can actually learn to do the self-hypnosis on your own. And we used to do all types of things when I was at the University of Arizona, where we could actually get ourselves into a stance, different types of trance, and we could actually try to even decrease pain and even type of discomfort. And sometimes people refer this to imagery or guided imagery, which is just the hypnosis or trance-like state where you actually have an image that you go to. So if you have something that you really are starting to have a pain with, and you have an image in your mind that when you start to feel this pain, you go to an image that's better or worse, or it changes, then you can actually affect it. And some images you can imagine, I just pulled that over the last several years that people have come up with, is these type of. So you can imagine the one, that koi there on the right, gasping for air. You can imagine that's probably not something that people that maybe with a chronic lung disease actually may feel. And this is an image that people have told me. They feel like it's that fish at the top of the water trying to gasp that breath. And then what you do, you make it so that that image gets improved. Same way with, I had a patient who told me that they had bad migraines, and the reason they got around that is that they felt like their migraines were like a flower that was really tight, and then the flower bed would open up, and then the migraine would go away. You can imagine, even from this one, what the trance might be, or what the hypnosis or imagery might be. On the right, it could be really not that great with fire and brimstone and smoke. This is actually a fire in Tucson a few years ago when I was down there, when the whole Catalina Mountains were set on fire. We watched this every night for almost a month. And then the next type is more celebration. You know, here you have awareness and the more like a celebratory about how you can feel elated and how that can make a big difference. And so these are type of imageries that you can see. People can go back and forth. Maybe one, you could have the burning in your chest turn into a celebration where now you feel better and liberated. You can imagine all these different things that people have talked to me over the years. You know, an ice pick, Darth Vader, elephant, a giraffe with a very long neck trying to get the air in and out. These are all images that people have used and use it when they do their mind-body different interventions. So there have been some studies that have been pretty relatively small in cystic fibrosis. There's one in 12 pediatric patients, 7 to 18 years of age, where the experimental group showed significant increase in their peak flow immediately after hypnosis compared to controls. However, the sample size was small and other factors such as medication adherence wasn't really examined. But they did another study of 49 patients, of which almost 90% reported that hypnosis is helpful for them with relaxation, which we just talked about, improve their tolerance for medical procedures and treatments, which I think is really a very key one you can do. And we've used all types of things like distraction for children and young adults for many, many years for unpleasant procedures, even things as venipuncture. Help cope with different things like headache, which is actually a common, and improve adherence to medication. And these are all different things that people have started to show. How about meditation? We've talked about this in a while, but meditation is this practice that uses a quiet location with few distractions. A comfortable position, either sitting, lying down, walking. You don't have to be not moving. It could be a walking meditation, or in my regard, a running meditation for many, many miles. A focus of attention such as a chosen word or essential words, and an object or a sensation of breath, and an open attitude, I think, which is probably the most important. And letting distraction come and go without judging them. So there's been a randomized controlled trial using 42 mild to moderate asthmatic patients who were conducted using mindfulness-based stress reduction on the quality of life and lung improvement. And they did show that there was quite a bit of improvement in quality of life and perceived stress. It didn't really affect lung function, but you have to remember these are very short studies, and a lot of these studies that I'm talking about for different types of mind-body therapies, you'd have to study them over not 6 months, over a year, but maybe over 2 or 3 or 4 years, or even over several years to see what the effect is. So it doesn't work quite like we do some of our different types of pharmaceutical type of therapies, so it really has to be more prolonged. Tai Chi is one that people are interested in. It's an ancient Chinese tradition which practices a form of exercise. It involves a series of movements performed in a slow, focused manner and accompanied by deep breathing. So again, it's like this moving meditation. It's low impact, minimal stress, joints make it literally safe for all ages and time, and it actually is a good fitness level. So you can have the very old, the very young, the very debilitated, almost anybody can do Tai Chi. It's also inexpensive. I mean, if you ever go up to San Francisco and on any given morning and look at all the different parks, there's a whole groups of Tai Chi all over the whole area, which is very common. And it requires no special equipment. There's an ongoing study now that I just thought was very interesting that I thought I would just bring up to you, is that the 72 patients over 6 years of age have 8 Tai Chi sessions that are performed home practice with the DVD. They had 2 groups, and this just gives you a little idea about how complicated it is to kind of design studies for cystic fibrosis patients sometimes. The group A was received one-on-one sessions, so again, infection control and all the things we talked about, so they got one-on-one. Group B was given an online source for their Tai Chi, and each group began with mindful breathing and meditative breathing known as Qigong. The moving meditation helps with the muscle movements, improves circulation and respiration, and mucus clearance was the thought behind this. And at the end of the sessions, they were shown closing methods such as self-massage to reduce tension, improve circulation and respiratory function. And the online sessions for the Group B were delivered using webcams and online video, even Skype. And the study results at this time have not been reported, but should be out in the next year. So again, this is a kind of interesting way to approach Tai Chi, or this moving meditation. And there's thought that it helps calm the sympathetic nervous system and engage the parasympathetic system, and helps improve pulmonary function, cardiovascular function, maybe even immune function, and reduces inflammation. So again, these are something that's very simple to do, doesn't take a lot of time, actually can be very health beneficial, help you with your posture and all the other things that we learned about yesterday that can help you with your breathing and your lung function and make a big difference. Let's talk a few slides about music. Music is actually another mind-body therapy. We know that Tess Dunn, Siri's daughter, has made this into her whole life. So this is something I think is actually very interesting. The studies with COPD have shown that music and singing can reduce anxiety and depression and general well-being. And this is a 12 bi-weekly singing session. There was a CF study, single-blind, parallel, randomized control, and it was done to determine if singing would improve respiratory muscle strength and quality of life. I just think it's interesting just to go over some of the details, because who thinks about these things, about how do you do a singing study? So 51 patients, 7 to 17, measured their maxillary inspiratory pressure, which is a way of your respiratory muscle strength, about how your lungs move in and out, especially the intercostal muscles, and also maxillary expiratory pressures. And they did a questionnaire study looking at quality of life as well. And the singing protocol was developed by musicians and music therapists based on the posture, which you know about, diaphragmatic breathing, vocal warm-up, and singing. Songs that were chosen consisted of high notes and sustained phrases, which makes sense. You want to really try to use that lung function, right? And the songs were chosen based on the person's list of favorite songs to maximize enjoyment, which is always a good thing to do in a study. So the subjects were given 6 simple singing tasks to be completed each day for the following 6 to 8 weeks. There were 11 patients that dropped out, which left still 40. And the results indicated there was no change except for the MEP, the maxillary expiratory pressure, and the maxillary inspiratory pressure. So there was some improvement in their respiratory muscle strength and also in quality of life. There was no significant difference in their FEV1, which is kind of the gold standard for lung function. But again, this is something that was always just over a short period of time. Maybe if they did this for longer, they would start to show some improvement. Or more importantly, maybe they would show that it would actually decrease the rate of decline in such things as lung function. In addition, there was no significant observance in quality of life measurements, so maybe the kids didn't like the songs as much as we thought they would. How about more music? This is a good one. Music therapy was done to improve the experience of CF patients during routine chest physiotherapy. This is something that can be a little bit of a challenge, especially in young children. This is between 4 to 24 months of age, and they put on music and they did this Likert scale. -3 was really negative. They didn't particularly care for it, and +3 was very positive. And the results indicated that children's enjoyment increased by 1.25 units, which was significant, and compared to non-significant change in the control group. So music therapy can be beneficial for CF patients, but they need to do larger studies, of course, which is what they always say. But they came to a definite conclusion. But again, if you think about playing music or doing something that would actually make the physiotherapy more enjoyable, and we know this happens all the time in teenagers and older children and young adults and even in full adults, maybe when they're doing their best in their different therapies, they have their headsets on as well. This is a nice study looking at motivational versus relaxation music during exercise. So, everybody says that you should exercise more, but I don't want to exercise more. Well, I have my tunes in. Maybe that makes a difference. So let's study it. So they had 37 patients with CF, did a 6-minute walk, and then under experimental conditions, they did listen to no music. They did it with relaxational music, and they did it with motivational music. And they came up with this 6-minute distance body weight product was calculated. So it's actually showing you how much you were actually working in the 6-minute walk. And they also did this feeling scale and this Brunel music rating scale to study this 6-minute walk with music that's either no music, relaxational music, or motivational music. And they showed that this work product actually was less when they listened to relaxation music compared with when there was no music. And the feeling scale and the Brunel music scale actually were significantly higher with motivational music than relaxation music. So it looks like they carefully selected motivational music, like everybody doesn't have to listen to Rocky, but something like that actually kind of moves people to move, can lead to positive effects in response during exercise and increase the enjoyment of patients' different forms of exercise in CF. Yoga is actually, you saw, is actually very common. According to the 2012 study, it's in the top 5 for all different types of therapies that are used by different people in the general population and also with chronic illnesses. So not many studies, but there was a recent prospective study to evaluate the safety of standardized yoga programs among CF patients aged 12 to 25. And they had a 50-minute yoga session twice a week for 8 weeks using a standardized program for health-compromised individuals. And the yoga sessions were individual to avoid transmission of infection. And the primary outcomes were safety and tolerability in this study, and secondary outcomes included respiratory symptoms, quality of life, lung function, ease of breathing score, which is a measure of exercise capability. And few reported cough, headache, and leg pain. I don't know if everybody in this room do yoga? You got some yoga people here? I tried to do yoga. I hate yoga. I mean, these asanas and stuff, you know, they don't work well. I tend to go forwards and backwards. I run. And so all this side piece, it just doesn't work. And so I tried it. It was good. It was nice, but no thanks. So I'd be one of these people that was like, I don't think I want to do yoga. But a lot of people, it makes a big difference. I like to do the breathing part of the yoga, the pranayama breathing part, especially through your nose, and really try to open up your airways. That's the good part. And some of the exercises, like, you know, the downward facing dog and things like that are okay, but most of them I didn't do too well with me. But it was tolerated with 10 and 11 that were chosen and did show improvement with quality of life. It didn't really show other parameters that made a difference, such as lung function. But again, I think it would be something you'd have to do over a prolonged period of time. How about meditative movement in general? So this is a study where they actually try to look at all the meditative movement studies that have been in all patients with any type of lung issues. This was just reported in 2014. And so they looked at Tai Chi, they looked at Qigong, they looked at CF, they looked at everything just as a form of general exercise, incorporating meditation, breathing, and relaxation. In this systematic review on evidence of the meditative movement on respiratory function in patients with CF. And they looked through Chinese and English literature, and they tried to really find how many were out there. And they found 1,600 papers, 43 of which were randomized controlled trials, including 30 in English and 13 in Chinese. But no studies really specifically looked at CF. And what they did at 11 studies included patients with respiratory disorders, and 27 included healthy people. However, few studies were of high quality. And they really, the trouble with most of these studies, they didn't really show much clinically important changes. But it doesn't really mean doesn't mean that it doesn't work, because they had a lot of reported of poor sampling, inadequate sample size, non-randomized designs, inadequate descriptions or randomization. So again, when you look at these, when you hear this in the press about how these studies were looked and they found that they weren't very effective, they look at all these studies in a very systematic way, but they held them up to very, very rigorous standards. And one of the things that you'll understand, that you need to understand, is that when you think about integrative therapies, you think about alternative and complementary therapies, they're hard to study. I mean, it's not like giving someone a placebo versus a different pharmaceutical and then measuring their effect over a 6 or 8 or 10-week period, or even over a half-year period. If you're doing something like Tai Chi, if you're doing something like acupuncture, if you're doing something like mindfulness meditation, those are things that are ongoing and very individualized. And so to get a randomized controlled, double-blind, placebo-based trial would be very hard. I mean, how do you do a placebo-based when somebody's doing meditation? You don't think that much, or think about something else? Or how do you do it for acupuncture? Do you put the needle in wrong? Do you put it in too far? Do you twist it to the right instead of to the left? How do you do music? Do you just listen to music or not music? Maybe you listen to music you don't like versus music you do like. And so you can see that these studies can actually be very difficult to do, but people are actually trying to look at them and actually trying to do it in a systematic way. So the last part of this talk actually has to do with, why does it matter? Why do we think about mind-body? Why do we think about these different types of studies? Why should we even think about that when we have all these other things to think about? We learned yesterday about all these different therapies that are coming down the pipeline, all these things to decrease inflammation, all these things to change how CFTR works. Why would it matter about mind-body therapies? Well, the mechanisms of mind-body therapies actually can be very important. Psychosocial stress and negative have been linked to pulmonary exacerbations, especially in things like asthma. So this has been known for many, many years now. Also in COPD, and also it's not been studied as much in CF, but I imagine it would be the same type of thing. You can see there's a couple of studies I just listed just to show you some of the highlights. Air cytokine response to acute and repeated stress in murine model of allergic asthma. Socioeconomic status associated with exhaled nitric oxide, which is a non-invasive way of looking at airway inflammation in acute stress in children with asthma. The distinctive effects of acute and chronic psychological stress on airway inflammation in a murine model of allergic asthma. This is the last one here is Dr. Wright out of Boston, who's been studying this now for over 15 years. She's looking at perinatal stress and early life programming and the structure and function. And so what she studied, she's followed a group of inner city women in the Boston area and actually looked to see if their children have more problems with respiratory illnesses in the first 5 years of life depending on stress. And that's taking into account such things as pollution and socioeconomic allergies and prematurity. There's more studies linking stress and lung problems as well. School examinations enhance airway inflammation to antigen challenge. So that just means that you're getting ready to have an exam, and if you respond to a different type of antigen, you actually have increased antigen responsiveness if you're under stress. Stress and airway resistance in children with asthma. Parental stress as a predictor of wheezing in infancy at a prospective birth study. So again, there's another one that just showed that even in the newborn period, you can actually have increased airway responsiveness or kind of twitchiness, just depending on how much stress the mother had before the baby was born. The role of acute and chronic stress in asthma attacks and asthma exacerbations in children immediately follow stressful events in life. So these are all starting to be studied more and more, and we're starting to look at it also in cystic fibrosis as well. So stress and susceptibility to respiratory infections. So several of the immune effectors released during stress, such as catecholamines, norepinephrine, epinephrine, dopamine, can induce changes in bacterial phenotype relevant to the biofilm formation and adhesion to host epithelials. So look at that. Just think about that for a minute, what we heard yesterday. If you have stress, then that can change maybe how the microbials actually are attached and how they act in your airways. Exposures of respiratory pathogens to stress-release hormones can also induce the bacteria to synthesize their own growth factors, the mechanism of actions which may be a non-transferrin dependent. And the effects of stress hormones exposure on bacteria can occur after initial stress has ended and catecholamine levels return to normal. So it could even last longer even after the stress may be over. So it's becoming clear that the microbial endocrinology has the potential to lead to a better understanding of how emotional states can modulate susceptibility to both upper and lower respiratory tract infections. And then the last couple words on placebo and mind-body. So the placebo effect, everyone has know about the placebo effect, right? When you do a study, there's a group of patients or subjects that don't get the tested medication, they get what's called the placebo. But we know the placebo effect underscores the psychosocial dimensions of illness prevention and treatment. And the effect of the patient and the patient's beliefs, attitudes, and expectations on the effects of therapies. The role of human judgment in assessing symptoms, reading tests, judgments, making diagnoses, and choosing treatments. The interpersonal and interpersonal determinants of compliance, the importance of physician-patient communication and support on treatment outcomes, and the relationship between social class, social status, and health. These are all part of the placebo effect about why does that make a difference? It's even been shown that the more expensive placebos are more effective than cheap ones. So that's why people say that if you have if you make your placebo a certain color, you actually may have a better response than if it's a different color. So, and people even looked at this like, maybe red is better than blue, maybe black is better than white. All these different things affect people as how they respond. And the placebos remind us that there is this mind-body connection and how mental status can affect bodily functions. And it may be that placebo really is just another manifestation of these mind-body therapies. So just on the side, when I was practicing in the Santa Cruz, Monterey area, I would have patients that come to see me with CF and asthma and all types of chronic lung disease. And they'd already kind of made the rounds. They'd already been to maybe to Children's Oakland, they'd been to UCSF, they'd been to Stanford. They were coming down to me because they just seemed like they needed more answers. They needed another effect. They needed to find out what else is out there. And I would go over what they've been done, their workups, their evaluations, the medications they were on, and actually they were all very well covered. They were on the right medications. They were on the right different therapies. Their evaluations were correct. But yet the parents and the families just didn't really feel like they had the connection with that group. So what I would do was I would just maybe change things around a little bit, just tweak it a little bit, but then I just would give back with a lot more enthusiasm. I would just say, like, we're going to get you better. We're going to make a difference. We're going to continue to follow you closely. And so this has to do with this patient, physician, and patient team interaction. And so I think that's really part of this placebo. If you can maintain the placebo, just think about it. There's really no side effects to the placebo effect. And so if you can really try to get that and enhance it, and I think that's what we talk about when we're talking about this interpersonal and determinants and compliance and the importance of this physician-patient communication. Here's just an example here. This is one that you've seen already. is the percentage of patients with 5% or higher, 10% or higher airways increases, and this has to do with the Orkambi study, right? But what I wanted to point out is that that bar on the left on each of these different graphs is placebo. So there was an improvement just in the placebo group as well. They weren't getting any of the doses of Orkambi, the ivacaftor, levacaftor. And you can see that there was an improvement in this group. So again, that's the group too that would be nice to enhance, right? There's no side effects of the placebo effect. And so that would also be nice. So how do you get that to work? How do you get that to be that part of your practice every day? And I think that's really what's important. I think that's why some patients and some families do better than others, because for whatever reason, they have that kind of attitude, they have that kind of idea, they have that relationship with their team. And I think that's really what you try to, that you need to really try to sponsor. I talk to families a little bit about, how do you do that? I think it's really important when you see your health team that you make sure that they have that mindful approach. I think that makes such a big difference, what mind-body therapies you use or don't use. Whether if you use yoga or singing, or if you do meditation or whatever you do, I think it's really important to have that kind of relationship with your healthcare team. And I always talk about you should have at least 3 things when you talk to when your practitioner comes in to see you, whether it be the nurse or the nutritionist or the respiratory therapist or the physician or whoever it is. They should be attentive to you. When you walk in, they should be looking at you. They should be really focused with you. They should have the right intention, and that they're there to help you. They're there to be part of what you need to talk to them about. And they should have the correct attitude with you. And it doesn't mean that they're distracted, doesn't mean they're looking at their phone, doesn't mean that they're looking away or they're typing on the keyboard over there and just kind of writing down what you're saying, but they really need to be focused with you there at that time. And so if you have that attention, that attitude, and that intention, I think that's really important, and that's when you have the best relationship. I always like to bring this up when I talk to CF, not only CF providers, but especially CF families and other care support, is that if you don't have that, I think it's the time that people can start saying like, well, why don't you just leave? Go back outside the door, kind of get your act together. When you can come back in and really focus on me, that would be great. Can you imagine doing that to a physician or to somebody in the healthcare team? I know some families who have, and it can be very, very powerful. It's like it just reminds people that we're actually there for you. We're not just there to make sure that what your FEV1 or what your BMI is or what your weight was or how many enzymes you're taking or what your pee looks like or not looks like or poop. Do you have all those different things are important, but you really have to have that other part as well. So I think that's one of the lessons I think we learned, and you can really enhance this whole placebo effect. You can enhance this because I think placebo really doesn't mean a sugar pill. I think it really means is that it's that mind-body part of what you do to make you feel better because you are better. You're starting to you decrease your stress response. You decrease, maybe it has to do with inflammation overall. It has to do with decrease your susceptibility to infections, to colds, to viruses, whatever. So I think this is all part of life. We all think about this when we talk about good nutrition. We think about this when we talk about exercise. We think about this when we talk even about posture. This all has to affect you. It all helps the self-image and all helps you feel better. So mind, body, and CF care. Do you think this should be a regular part of CF care or just a partial part? I think it should be a regular part. Every clinic should have some type of mind-body therapies. And some people do this just not even thinking. They just have a wonderful group of people who take care and staff who take care of their families and patients. They're all up, they're all excited, they're all happy to see you. Everything is always running well, smooth. That in itself is a positive mind-body. There's many types that you can use. You can consider exploring the ones your patients and families may be interested in. I always use the example is that maybe if a child is really needle phobia, I might say that might be the best person to say oh yeah, you should go see an acupuncturist. That probably wouldn't work. So you really want to find out kind of what they would be interested in. Are they, if you use the word hypnosis, sometimes a lot of families and some care providers think that, that means that you're going to get up on the stage and cluck like a chicken, or do the type of things that you see in different types of acts. So maybe hypnosis isn't the right word to use. Maybe you talk about imagery, you talk the powerful type of suggestion. You think about things like meditation, and you think about things like mindfulness. So I think these are all very common, and you'll get a lot of response from different practitioners. Maybe we should be doing just as much mind-body therapies for the caregiving group as we should be doing for our families and patients as well. I think we all are under stress. We have a lot of issues that come up, and that actually gets related over to the families as well. So how can we take that relaxation? I carry a card which I I didn't put it in my pocket this morning, but I carry it every day. It's a laminated card that I carry out. I pull it out about, 10 times a day. It says, "Take a breath." I usually do this when I'm going back over to Santa Cruz and I'm on 17 and I'm thinking like, oh my God, it's Sunday, it's beach traffic, take a breath. I might take it out. I just keep it on the dashboard on that one. You have to know what's available locally to your families. I mean, are they interested in Tai Chi? Are they interested in meditation or yoga? And really support that and try to find the practitioners that are good with children or young adults or older people, especially older patients who have any type of core morbidities like lower back pain. These therapies may improve clinical care depending on the patient, stress, adherence using CAM, highly motivated, socioeconomic level, and education, but I think it's actually very common. And then I think this is actually a really important one. Think about training a team member in the clinic to become a mind-body practitioner in one or more of these modalities. We have a physician assistant that I've been trying to encourage him to learn about how to do hypnosis or imagery. You can do yoga. You can do different things like mindfulness. It could be an MD, a PA, an MP, RN. It could be your dietitian. It could even be one of your medical assistants can do this. And so I think the ones that I've seen, I didn't even include PT, which is now shame on me because that's what I think is very important to have in your clinic if you can have it do it. It may have a really powerful and positive effect. So I know that we're still running a little bit of time, but I've left a little bit more time for questions. So again, thanks. This is me in one of my trances up here in the Santa Cruz Mountains. And so just remember, is your mind full or are you mindful? And I think that's actually very important to think about as well. Thank you very much.
Okay, we do have a few minutes for questions. Please use the microphone if you have a question and wait for the volunteer to sanitize it. Please limit your questions to one per person. And also remember, Dr. Mark will be on the Ask the Experts panel. It's coming up next.
Good morning.
Good morning. Thank you so much, my hero. So, Dr. Mark, I have a question that's somewhat related to what you talked about, but a little bit out of the mainstream.
We like out of the mainstream. It's California, Yeah.
I wonder if you can comment on the gut brain. And the gut brain meaning like the way that we feel with our gut and how that might impact CF-related constipation.
Yeah, I think the whole, that could be a whole talk just in itself. The whole mind-gut relationship is actually very powerful. We have more neurons and more neuroreceptors in your GI tract than you almost do in your brain. So how that affects CF and how it affects things like constipation, how it even affects lung function, I think is very powerful. And so I think we've already heard a little bit about the microbiome of the lungs. Well, we always talk about the microbiome of the gut as well. And people have talked. A lot of people take prebiotics, they take probiotics, they take things like fermented foods more. It's all becoming more of a rage because your gut is actually the entrance, just like your skin is, into your system. And so if you have a really healthy gut, you could actually have a very much a healthy body as well. So I think the gut has to do not only with what you eat and what you think about, but also how you act and how you relax. And all these mind-body therapies I'm talking about actually could relax the gut. We know that children and adults with inflammatory bowel disease, be it irritable bowel disease or even things like Crohn's and ulcerative colitis, the hypnotherapy and those type of therapies actually can decrease even better than any of the medications that are out there, the exacerbations of people with chronic abdominal pain from whatever type of inflammatory bowel disorders that they may have. So I think the gut is actually a very powerful thing to do, and that's actually one of that we know that if you can relax the gut, you can actually decrease that type of pain. You can actually even overcome things like constipation and other types of things that you see with inflammatory bowel disease or irritable bowel disease.
Thank you for your talk. I've always been incredibly skeptical about mind-body stuff when it comes to medicine and CF especially, but your one comment about expensive placebos working better than cheap ones actually is giving me a ton of like, wait a minute, maybe I need to relook at this a little bit, because it really just struck me as there is more to this than just somebody
Right.
convincing themselves that they feel better, but I just wanted to comment on that.
Yeah. Thank you. You know, some of these different proton pump inhibitors that have come out, you know, people in the pharmaceutical industry have really looked very carefully about, you know, what size the pill is, what color the pill is, you know, purplepill.com, you know, when Nexium came out versus Protonix versus all the other ones. This is not saying that they're not different, not saying that one may even be better than the other, but there also is this aspect about what people think they're going to get from it and how they look at it. And so you want, you know, when they think about these things, they actually look very carefully as to kind of how they approach it and how they would market it, because that does make a difference. You know, even to the color of the background of the ads that you see. And you've all seen all these different types of different therapies now that are advertised on TV all the time. And, you know, and again, they always have these very wonderful looking, people look very happy even when the person in the background is going like, there's an increased risk of death, there's an increased risk of this, there's an increased risk of that. And they list like 30 things or 40 things. It's like, I think I'd rather have the diabetes. I think my hemoglobin A1C maybe not that bad to be a little bit higher than all these different side effects. But, you know, again, that's how they kind of market it. And a lot of it has to do with that effect.
John, thanks. That's great as usual. There was something sort of hidden in your talk that I think is important. You showed the slide on the Orkambi study and showed the placebo effect in that study, which is very typical.
Right.
And illustrates the power of the placebo effect. But the other thing that it really emphasizes is that when people do clinical studies, they generally do better because of the placebo effect, especially in chronic illness. And oftentimes when clinical trial results are translated to the real world, where things are studied outside of clinical trials, the effect is less,
right.
Probably because there's less of a placebo component. So in essence, that's an argument for people participating in clinical trials, because no matter what happens, even if you get assigned to the placebo group, you're going to have some improvement. So I'm using your talk as a pitch to remind people, participate in clinical trials.
Thank you very much, Dr. Moss. That's a great point. I mean, actually, you should be first. I mean, it's a little bit what I said earlier too. When I said I saw patients down in Santa Cruz that didn't really know how to change things, you know, because they were already on the right medication. So I would just change them up a little bit, or just kind of say like, let's do it, you know, standing in the corner as opposed to standing near the window. I mean, all these things, it's kind of like what you do in a trial too, and then you also have the extra benefit of whatever the different therapies that you're starting to study that actually can make a tremendous difference. But that also is part of it as well, is that whole kind of, that part of participation, that part of being part of a community and a family. And I think that improves health as well.
Hi, John Mark. Nice talk.
Thanks, Candace.
I appreciated the last part that, as you know, we're pretty busy in clinic next week, right?
Right.
So me being the only respiratory therapist for 20 pulmonologists, will you be implementing that, that mind-body release for the clinicians in starting Monday, maybe?
Well, I have to admit, I haven't sold it to our center yet, but I've already approached Julie Desch about coming over and being our mind-body practitioner to do her mind-body stress reduction just for our clinic staff, not just for our patients. So I'm not sure it'll be Monday though.
Hi, I'm also a practitioner. I'm a nurse at the bedside. I struggle with my own mindfulness practice, and my ratio is 5 to 1 at the most, could be as few as 3 to 1, but I might not have the kind of time that would need to be spent to do some of these mindfulness practices with patients when they're in the hospital, they're in for an acute exacerbation. So this, like, what time would be better than to try to do this? But I literally may give them their medications and have to run to someone down the hall. So what would you recommend I do in that very brief moment of time that I might have with my patient at any given moment?
Well, I think that we all know that the fastest way to get out of a room is to actually speak slowly, is actually try to sit down, even at the bedside, even on the side of the bed. I know a lot of times with our patients, we are kind of geared up in all our respiratory gear and masks and gowns and stuff like that. But even with that, I try to make that eye contact. I try to really speak about what I'm going to do, how I'm going to do it, and then I'll be back when I can to discuss more. I think just by taking and make sure that they know that you have that intention I think is what really makes the difference. And so, the worst thing you can do is just go in and say something quickly, just do your intervention or do your therapies or give your medications and then just leave. I think it feels like it's like, wait, what happened? And so if you can just take that extra, not 15, 30 seconds is all it really takes, is they have that connection. If you can get that connection, then it makes a tremendous difference. Got all the hard people coming up here.
Thank you for that talk. This is a subject that's very near and dear to my heart. And I wanted to just share something from the perspective as a parent taking care of a child with a serious illness. And when my Anna was diagnosed, she had nearly died and she was very, very ill. And so I had already been interested in these kinds of therapies. And I took her to an acupuncturist, a Chinese doctor in San Francisco. And actually I have to report that the acupuncture was really positive, made a huge difference in her digestive system. And to this day, Anna's 36 and she still goes to acupuncture and she feels it's hugely important for her gut. Mm-hmm. But the process for me of choosing something else that was positive, that it gave me something to do, that I could participate in, that I could come home with the herbs and I could cook her tea and she would drink her tea in a bottle watching Sesame Street, all those kinds of things. And as she grew up, we did these other things. This helped me. It helped her, I believe, but it really helped me. And I think a lot of moms, as we know, are suffering from a lot of depression and feeling that they don't know what to do, and also our community is so separated because kids can't be together, that these are kinds of things that really help if you want to do essential oils or there's yoga with your child or something that really enhances your ability to be able to cope and accept and deal with this disease.
Thank you. I think that's a great comment, and I think it's actually very important. I think the whole idea of how you take control and how you have your part of your child or your own health is very important. And so we know there was a study that done a few years ago by Ann McMullen up in Rochester in their CF center there too, showing that even if practitioners have the conversation with their patients and families about the therapies they're doing, they actually get better adherence to their conventional therapies as well, just by having the conversation. So if you actually say, oh, you're on a homeopathic remedy, what is that one? Tell me about it. Or if you're doing acupuncture for chronic abdominal pain or for constipation or for different types of GI issues, let's find out who that practitioner is. Maybe that's somebody you can actually show. I mean, we have a practitioner at Stanford, Ann Mingye, who is one of our peds GI people, who is doing a study on using acupuncture. She's a licensed acupuncturist for her kids who have chronic abdominal pain. And she's starting to show big results, and she gets referrals now from all over the Bay Area. So I think that whole mind-body, the whole mind-gut that we talked about earlier is also part of this. The thing about Chinese medicine and all these different remedies that you talk about, and all these different types of practitioners, is like there's good ones and there's bad ones. Just like there's physicians that we think like that's the go-to person. There are other ones like, well, maybe not so great. Is that, you need to find out who that is. And that's what this community is also about, is to find out who the practitioners are who are comfortable with children and young adults and older adults with cystic fibrosis. Which practitioners seem like had the best type of attitudes and were willing to work with your conventional practitioners as well, because it has to do with this whole team approach. I think it's really important. But I think what you said is actually is just as important, and maybe I should put more emphasis on it next time. It actually gives a lot of benefit to the families as well, especially to the primary caregivers. Thank you. Thank you very much.